Commissioners, good morning. Good morning, County Administrator, Commander Baker.
Got promoted.
It's my pleasure to come here always to give you updates, and we will start with our first slide, which I have right here. I want to point out this is the U.S. map. This is from the Johns Hopkins data. I want to remind people that the Johns Hopkins data is the same type of data that we have on our web page for our dashboard, and you can access the Johns Hopkins through the web page, our dashboard. This is the U.S. numbers, and I want to look here at the 3 peaks. The first one that we had was in April 9th, where we had 34,000 plus cases. Then on July 16th, after the 4th of July weekend, we had this additional peak, which with the largest number in one day of 77,362 cases. And then this was also our second wave, so to speak. And then this is where we are now on 10/16 with 69,000 plus cases. I want to talk a little bit and show you in special the whole idea of flattening the curve. When we say flattening the curve, we mean making this curve go up and then coming down all the way to the bottom. So this occurs when you open too soon. You never get to maintain the curve down all the way. And this is what happened then after the 4th of July. Again, we're coming down, we're thinking all is good, but we don't flatten the curve and maintain it out. So if this is our next curve going up again, hope that this will go down very quickly in the numbers to come, but I'm concerned because we're seeing large increases of cases throughout different states in the United States right now. So we really have to be very vigilant. As you all know, the second wave is already occurring in Europe, and usually we're next after Europe. So we got to keep that in our toolbox and keep that curve going down here in Palm Beach County, which is where I will go to here now to Florida. And we see that we have had an increase of 1,707 cases, the total cases being 756,727. We have had 72 hospitalizations in terms of the state, with the total hospitalizations in Florida now being, since the beginning, 47,125 due to COVID. And our deaths, 16,021, which is an additional 54 deaths. Now, again, I'm going to remind everybody, for those who haven't been paying attention or may not remember what I say, that these 54 does not mean that on this day we had 54 and this would go way up, right? They're going to put these deaths in all these little columns going back as far as the actual date of death. So our deaths in terms of Florida have been going down. In terms of our cases, I think if you did a trend line here, you actually see a little bit going up. And again, we're concerned that we're not seeing that increase too badly and that it will stay below the numbers that it needs to be. Our next slide shows what we look at all the time, the 2 positivities. The first one being the daily lab positivity, which is at the state, it's been down below 5, it's 4.83. And then the total people tested since the beginning at 13.17. Right now, with this number of people being tested and our population in Florida being 21 million, close to 500, we've tested 27% of the population in Florida. Our next slide this is a new graph that's available that is on the dashboard now for the state. It looks a little cleaner. Again, same type of information. The deaths definitely going down, but the new cases by day if anything, it might be flat, maybe going up a little bit. And then the new case positivity, the little number, has been pretty flat, and we want to see that going down, like we see in other cases prior to our reopening. So we want to make sure that these things are going down. These two indicators here, I don't understand why they're using them, because influenza-like illness and COVID-like illness really are the same things. You have the same symptoms. We seem to have more COVID, that just dependent on how they're admitting or looking at these patients, whether they come in for a complaint of COVID or if it's just coming in for something like the flu. So I don't think these two are very interesting to look at. In terms of our number by county, we remain in the same spot. We remain number 3, with Dade being 100,000 plus, Broward 81,000 plus, and then our 49,068 new, with 47 new cases being reported, 7 new hospitalizations at 3,984, and 7 deaths since the day before at 1,497. Again, we actually have not had any deaths since October 7th in the county, so all of these are probably going to be backdated to the actual date of death. The rest of our counties remain in the same order, with Hillsborough, Tampa being at 45,000, followed by Orange, Orlando, then followed by Duval at 32,000 plus, almost at 33,000. And then our counties surrounding us, Collier at 12,920, Henry at 2,089, and Martin County 4,994. The number of cases in these counties have remained low, so we're very grateful for that, and we're doing a lot in terms of planning for our agricultural community and making sure that we will have testing available to them. Hopefully we will be going to them using our mobile vans, and we've been working with the agricultural as well as with Commissioner McKinley on making sure that we don't have the problem we had last year with all those people coming down positive, and the agricultural workers. This is the comparison side by side of what we had last time at our last update at the Board of County Commissioners, and since then we've seen some increases. Dade remains 6.5% of per population. We've added to Henry, above Henry we have Glades. Now they're there. DeSoto and Hardy remain the same. We then have added to the orange, the darker orange, Hillsborough, Polk County, as well as the one above that, I believe that's Sumter. Volusia now has turned this darker yellow, as has I forgot the county, but that's okay. So you see that we have one more yellow here. Up above here, we have a lot more increase in terms of the greater than 6%. These are all at about 6%. We've added up above Columbia and Baker. This is Union here, so Columbia and Baker, and then we've added Franklin here below this area. Tallahassee remains in this nice orange color. They're behaving very nicely. So Lafayette was the one that started way up here. They remain at 14.1%. They have not been able to reduce that number of cases in their community. So that's just the rate map. I think it's very useful and kind of sees where we are with the other counties. We're also using the census tracts, and this is very useful because we can actually zero in on the counties by the census tract as opposed to our whole zip code that didn't give us a whole lot of information. So you can see that the Glades area is pretty clear right now. Just a few little cases here in terms of the numbers right in downtown of Belglade. One little census tract right there. And the rest of our county, yes, has a few cases. As you can see, we do not name anyone under below 5. We do not enter those because it's too easy to know who identify people with that information. The light pink is 6 to 7 new cases during this week. So this is giving our municipalities and our folks at the Emergency Operations Center, Mary is using this to send out for testing in these specific areas where we're having hotspots. And again, they're between 24 to 60. So we're not having huge numbers like we had across the corridor here in the middle of the county. That's very important, and we're very grateful for that. So our first slide that I want to say that is very encouraging is that our total people tested positivity has continued to go down very nicely. This is a beautiful trend that you see day after day, actually decreasing by 0.2 of a point, and has been steadily going down. This is as of Sunday for the 18th, and so we have here the 2 weeks of data, seeing that it's decreasing very nicely. What is not decreasing very nicely is our next 2 slides, which is our new COVID daily cases. And these are the numbers. This is the number for Sunday. You can see that on Sundays we have very low numbers because some of the facilities are not open for testing, so the numbers are low. And they tend to go up as the week continues. But this trend line is concerning. For the first week here from October 5th through the 11th, we had an average of 124 cases per day, and this last week it went up to 147. That's these 2 numbers. But look at what they were when we presented to the Board of County Commissioners last time that we were here. We went from 184 down to 127, and we were down to an average of 101 cases per day. These are going up. The data that is not published yet today says that our new numbers for yesterday were over 200, and our positivity rate is above 5. So I'm not causing panic. I'm simply saying that we have to be very cautious as we look at these numbers and try to determine where they're coming from, and be prepared to do what we need to do to put perhaps additional control measures in terms of stopping the spread of COVID. This is our daily lab positivity rate. Again, you see this going up slightly, again, to being Sunday, the last day that we looked at this. And so what I'd like to do is that we have to determine, in order to be able to make good executive decisions, we have to determine where are these cases coming from. In the past, we were emphasizing that the majority of the cases were coming between the ages of 15 and 30 and 44. That's this red line right here. As you can see, the new cases that we had for the 66 cases, we had 18% among the 15 to 24, 9% up to 34, and then 20% for up to the 44. So these 2 only make up 27%, almost 30%, but what we're seeing here is a growth in these numbers here a little bit older. So it looks like the 35 to 44 through the 64 have over 50%, right? If you add these numbers up, you have 50%. So I'm concerned that this is shifting somewhat, and the concern there, implications for that, means hospitalizations and possible starting to have deaths We had very few people here under the 85 plus, which are much higher risk, 41% of death, and a few cases here. So we need to keep a very close eye on this, and Bill has a lots more of our indicators for our CPR target, which I will let him talk about. So again, not trying to panic, but that we're starting to see that shift. And so again, we have to be very careful and make observations and be ready to make necessary moves to increase prevention actions to stop the spread of COVID. And I can't leave without saying what I need to say all the time. We need to be prepared, continue to have our masks up, washing your hands and sanitizing, getting your flu shot, and of course, avoiding the 3 C's. Very important. There's a new pamphlet for that shows, and that means staying home if you're sick, but the 3 C's is avoid close spaces, crowded areas, and close contact spaces, such as where you're in close contact speaking with people, especially at a bar, at a party, at a wedding, where you're talking closely without wearing your masks. And we have to try to not forget those issues when we're trying to stop the spread. So that concludes my presentation. Like I said, Bill has much more interesting charts, and I'm open for questions.
Very good. Thank you, Dr. Alonso. We're going to move to questions briefly. Start with Vice Mayor Weinroth and move to Commissioner Valichet.
Dr. Alonso,
Good morning.
you're back.
I am.
Can't we stop these meetings?
Please.
I wish. All right. I'm happy to hear that we've had no deaths since October 7th. That certainly is a bright note in your presentation today. Anybody who watches the news realizes there are 30 states out there that are out of control. I keep on looking at Florida, and it is not one of those states. So, we have certainly at least broken the back of this near term, but we also know that there are no borders or there are no police stopping people from coming into our state from New York and places up north where the snowbirds would like to flee from. So obviously some of those infected people up north are going to show up on our doorstep. On the other hand, our governor has taken a lot of our tools away from us. And so we have very little we can do other than, as you said, implore our residents to keep their mask on where they can't socially distance, and again, mask up, lather up, and sleeves up. So all we can do right now is basically impress upon our residents that it's not over. Certainly flattening the curve. I think we flattened it as far as complications. We flattened it as far as mortality. When I look at the number, and you pointed to the 12.35% as far as the overall cumulative number, and I guess I'm not quite sure why that's different from what was on the chart at 13%, but I'm not going to worry about the difference in the numbers. To me, that's a positive number.
Which slide are you talking about?
When the second chart you gave us where you said Florida positivity rates, and you gave the graph of 13.17%, whereas on your test positivity, you showed 12.35%. And I'm not...
This is Florida's positivity rate as
Right.
of yesterday. That's still what's on the board right now.
And on the bar graph you had given us, which is labeled Palm Beach County total people tested positivity, it gave 12.35.
And that's Palm Beach counties versus the state. The state is the first one.
And that, all right.
Okay.
I understand. Okay.
Got it.
But to me, that's a positive number, because that means a percentage of our population has now gotten the infection, and this, quote, herd immunity we're getting closer to that point. Am I reading that correctly? Is that a positive number or a negative number?
It's a positive number in the fact that we're going down. That number should go down to 10. The total positivity, the large number, that is all the people tested and the people who are positive, that number should go down to 10 to be at the goal the state has set. We are still far away from that, and only having positivity for the population in the teens will not protect us. It needs to be perhaps as high as 60 or 80% before you can expect herd immunity. So that's going to take some time. Pardon? Yes. So we're far from being where we need to be, but we're getting there, and the tools that we can still utilize perhaps are curfews or other ways of trying to reduce. If we can analyze where these people are becoming positive, it's not the kids at the schools. It's again those going out. You can walk down Clematis, you can walk down Atlantic, and see that people are not protecting themselves. So we have to get that message across, and get it across to everybody that, I'm hopeful that we can keep Palm Beach in a little island like Tallahassee is, and
Well,
everybody around them
unfortunately, we
can
know
be
that's not
positive
gonna
and we're
happen.
safe.
All right, well, and again, I think that it's important to state that notwithstanding the fact that people are not presenting at the hospitals and the mortality is going down, we don't know what the residual impact is going to be on people, whether the damage to their lungs is going to be long-term, and so I would sort of caution our residents not to just say, well, people aren't dying of this, so I shouldn't worry about it. It's certainly a disease that needs to be reckoned with, notwithstanding some people who think that they don't have to worry about it. But again, thank you for your presentation, and I look forward to the day that we don't have a presentation.
Thank you,
Amen.
Vice Mayor Weinroth. We'll move to Commissioner Valashay, then Commissioner McKinley.
Thank you, Mr. Mayor. Good morning, Dr.
Good morning.
Alonso. I just had a question about your chart that's headed PBC COVID age distribution of new cases and new deaths. I think we could get better information out of this if we changed it slightly. Your new cases are current, but the hospitalizations and the deaths are cumulative. So we're not really getting a sense of the people that are being infected that week, what the severity of their disease is. In other words, whether they're being, I know the deaths will lag, so you can't get a week-to-week, apples-to-apples
You
comparison.
talking about this slide, sir, or the
No,
one?
this-
Oh,
this
that
one.
one, okay, sure. This one shows, yes, this one will show you the new cases for this date.
So if we could see, here's how many people got this week, and here's how many required hospitalization that week, rather than the cumulative number, I think it would tell us whether the disease is in a mild form, in a virulent form, or somewhere in between. And as I said, deaths, probably take a few weeks. We could probably figure out a way to, back test or back work the death numbers into those weeks that they occurred in.
Yeah, and we
and
do
get
have
a
that.
very-
Bill will show you those slides.
Okay. Oh, you do have that? Yeah. Oh, okay. But I think current to current would be, more indicative of where the disease is in the community. Thank you.
All right, very good. Thank you, Commissioner Valashay. Commissioner McKinley, you're recognized.
Hey, Dr. Alonso, can you go to that slide that has Florida by Florida?
Say again, which one?
The one that compares Florida from a week or two ago to Florida
The
today.
population, that's called the rate map, this
Yeah,
one?
that one.
Okay.
So you noted that Tallahassee right now is an island, and I'm looking at that map, and they're an island that's about to be flooded. Because I've got to ask you, you are a public health expert. You've been doing this for a very, very long time. It's my guess, based on some of the policies that the universities have regarding quarantining students and moving them out of their dorm and having, for those of you that went to FSU, the quarantine dorm is Sally Hall, and nobody wants to live in Sally Hall even when they're healthy. So I think that you've got a lot of students that aren't getting tested. And I think that we've got a large segment of our population that probably they're walking around with COVID, they're going to work, they may have a sniffle, they may be asymptomatic, but they're not getting tested. So are you guys, I know in political polling, we call it a margin of error, any kind of guesstimate on what we're really talking about? I mean, we're only talking 27% of the population has been tested. So the numbers that you're presenting to us are people who are responsible enough to go get a test and find out if they're dealing with it or not. Any kind of public health estimate on what we're really looking at out in the community?
Well, this map, because it does give you a COVID rate per 100,000, I think is very indicative of what's going on much closer, like Commissioner Valashay said. And you see that both in Tallahassee, Leon County, as well as in Gainesville, that those numbers are probably, or definitely have a lot to do with college students. Alachua is right here. If I can get, that's Alachua. So you see that these colors are similar. And of course, in Miami, we have many universities. So that age group that we've been talking about, that 15 to 44, those are the people that are most likely not only to be tested positive, but are the ones that are spreading the disease. And like you say, many of them will not get tested. So I think that number is much higher of those individuals that are positive spreading the disease. The comment that my son gets, they laugh at him because he's wearing his mask. I'll kill him if he doesn't wear his mask. So perhaps that's why he's wearing it. But they tell him, hey, dude, what's the big deal? You know, you're just sick for a few days. It's no big deal. And he says, yeah, but I want to go home and visit my mom so I can't get sick. So at least he has that excuse. But they're basically really ridiculing people who are wearing masks. And, you know, the youth is the youth. They've always thought they're invincible. We thought the same thing when we were young, too. But so I think it's a matter of educating and trying to get a better sense to people do the right thing for the sake of the businesses, okay? For the sake of your grandparents, for the sake of the elderly that you might be passing this to. It might be to somebody in a business that this young person ends up passing it to. So we have to learn to take that responsibility and not just think about ourselves, think about our community, think about the businesses that we want to stay open, all these things so that we can, you know, this is going to take a long time. I really like the woman saying 2 to 3 years before we get back to normal. This is not going to get back to normal anytime soon. So it's a message and something that we have to learn to live with for quite some time. And again, I'm very concerned about the second wave that's occurring in Europe, and that looks like we are at least, if not our second wave, at least it's a peak that we're reaching, and I don't think that's the end of the numbers. I think those numbers are going to continue going up, and we're going to see that third. And each time, as you can see, it gets a little higher. And that's because the people are getting sicker and spreading it to more and more people.
And now if a college student, let's say a college student in Tallahassee tests positive and their driver's license has a West Palm Beach address, are they counted as a Leon County case, or are they counted as a Palm Beach County case?
It will get counted in Palm Beach County. So those numbers are being spread, which is why I think that Tallahassee is low and Gainesville is low, because a lot of those students are not local. So TCC may have more positive students reporting in Tallahassee, but the rest of them are probably recording in the other counties or out of state.
Okay, so I certainly wouldn't say that they're an island based on what I hear. I can tell you that Franklin County tried to become an island. The sheriff had actually asked the Florida Department of Transportation if they could start carting people at the bridges back in like April or May, and DOT said no, and now look at them in the bright red. Also, if you look at those maps and you look across the panhandle in those dark red counties, those are some of the most rural, poorest counties in the state of Florida, and you can see what happens after years and years and years of bad leadership in Tallahassee and decisions to cut public health programs, what happens in those rural communities. So thank you, Dr. Alonso.
You're very welcome.
Thank you, Commissioner McKinley. Commissioner Weiss, you're recognized.
Thank you, Mayor. Just a couple of, ask you to clarify a couple of things. This idea of herd immunity, I mean, if I did my math correctly, we've had about 50,000 cases so far in Palm Beach County. We've got about 1.5 million people. That would translate to about 3.2% of our population has had COVID. And even if we doubled it, which because they say a lot of people don't get tested or never even knew they had it, and it's still only 6.2, and you need to get to what they're saying, maybe 60, but most likely 70% of the population would need it.
Absolutely. We're far, far away from herd immunity.
And it would cause a lot of people, the expectation is a lot of people would end up hospitalized, and many, many of those would end up dead. Is that correct?
We certainly don't want to see what we saw in the past peak, because those people then do spread it to those who do get sick.
Right.
And of course, the whole issue about our hospitals and our medical system, it stresses out the entire system. So again, yes, we want to keep the hospital safe. We want to keep our staff safe, but it has consequences, and also consequences to the businesses that are trying so hard to stay open. Many businesses are seeing that people aren't coming, but they will slowly start showing up, and then if they're not wearing their masks to and from the restaurants, that's all possible spreading. So we need to really keep a very close eye on this and make decisions as we go along. What are other counties doing? What are other places around the country doing to reduce the spread without closing down businesses? There are things that can be done. We did them ourselves here before, and we may have to go back to some of those, restrictions in order to stop the spread. And
then, when we talk about 27% of our population or 23% of our population to have been tested, so far, but the fact is, if you're tested yesterday, you can have the virus today, and you would need another test. So to me, it's sort of it takes us off in the wrong direction. I mean, it's good to know how many people have been tested, but if they were tested a month ago, it has no bearing on the what's happening right now. So to me, it's a little specious to, I'm not sure what I'm supposed to understand from that.
Two things. One, it's important to get tested if you have symptoms, obviously, and it's important for people to get tested when we talk to them, that they've been a contact to somebody, make sure that they stay home in quarantine for the 14 days. All family members need to stay home. Kids should not be going to school if one of their family members are positive. A lot of our positive kids that have come up positive in the schools is because from family members, and the families are not keeping their kids at school. So not only should you not send your kid to school if he's sick, you should also not send him home to school. They need to stay home if they're in quarantine. Very important, including daycare. We just had a case of a mom positive with a baby that needs to be quarantined. We had to explain to that mom why the baby had to stay, even though she is now over her period of isolation. The baby needs to be quarantined for the 14 days. So that's important for that reason. The second reason it's important is to understand what the rate is in our community. And so that's why we need that federal national plan for testing and the rapid tests and everything else, so that we can understand at what point, it's for statistical reasons, but to be able to understand how much of our population has been affected and the truth of what's actually happening with this virus. So it's a way to better understand the virus, to be able to understand how it is affecting our communities, and then for the testing to make sure that those people stay home if they are positive. Remember also that we've had the first gentleman now who actually tested positive for the second time with proof that he tested negative and then became positive again. So that's important to note. If that's true, that hinders somewhat the vaccine, because if the immunity of the virus itself doesn't give you constant immunity, then how will the vaccine work? So all those questions are still up. We're still at a very early stage of understanding this virus. It hasn't quite been a year yet, and it will take several years for this to really wrap our arms around the scientific knowledge of this virus.
And then I guess the last point I wanted to make was, I mean, even if we're testing about 5,000 people a day, it sounds like it's a lot of people, which it is, but we have a population of 1.5 million people, so that's 0.3% that gets tested. So even if a number of those people are getting retested because of work or some other reason. And so, we're even if we say 5,000 tests are being done, it's not always 5,000 people. If we look at it over time.
Absolutely.
Okay, thank
All
you.
right, very good. Thank you, Commissioner Weiss. We're going to go now to our county emergency manager for a brief presentation. I want to remind members of the public and the board that we have a time certain, 12 o'clock, for our litigation meeting. My aspirational goal, since we do have one public comment card here left on an agenda item 6C1, I'd like to try to get through that agenda item prior to us taking a break for the litigation meeting so that we can have the member of the public depart if they'd like to do so. Mr. Johnson, you're recognized at your convenience.
Thank you, Mayor. On this 218th day of our Emergency Operations Center activation for COVID-19, I'm presenting you my weekly update of the COVID-19 phased restart program. You can follow along. I emailed you and sent you, or have you a copy in front of you. As you can see on the matrix, we met all but 3 of the indicators on the matrix this week. The overall positivity rate, as Dr. Alonso pointed out, continues to decrease, and this week it's currently at 12.35%. This slide shows our daily lab positivity rate. Dr. Alonso showed you the linear line. The line that I am showing you down in the lower left-hand corner is a 7-day average. That line also is increasing slightly. The graph in the upper right-hand corner is the overall from the overall rate that we've been monitoring since the beginning. Again, our rate has been increasing slightly over the last 4 to 5 days. Again, we in the Emergency Operations Center continue to monitor the root cause. We are collecting school data. We're having calls with our universities. We have weekly calls with our hospitals, and again, Dr. Alonso is in the EOC nearly every day on a weekly basis. So, next slide is our total hospital census. Over the last week, again, we saw fewer patients hospitalized, and we're seeing about 2% of our patients countywide using hospital beds for COVID. We saw 6 fewer patients countywide on average over the prior week. Again, as I said, we're holding weekly calls, but as you can see, that line, the red line, which is the trend line, looks extremely flat. This is our slide regarding deaths. In terms of the right-hand corner, the upper right-hand corner shows our deaths are continuing to decline. The graph in the lower left shows that ending October 10th, the average death rate was down to 1.2 deaths per day. ICU cases here too. We're seeing fewer ICU cases. We saw a decrease of an average of 4 fewer patients per day countywide. The red line there shows you a 7-day running average. Again, it is decreasing, but it is it's starting to flatten out. Our countywide ventilator utilization rate, again, has remained at about 39% capacity. Our daily medical alerts, again, from the Palm Beach County Fire Rescue here too. Again, you'll see the lower left-hand corner is the extended data. The upper right-hand corner is the most recent data over the last month. Again, we're seeing a little bit of an uptick in the last couple of weeks. We're seeing we continue to monitor our ED visits with CLI. We've seen, for the week of October 11th, we saw our ED visits with CLI decrease to 182 cases per week. Testing sites, we've tested 26.5% of the total population here in the county. We continue to have 13 government, 4 nonprofit, and 102 commercial sites. And again, Palm Beach County Fire Rescue continues to do the mobile pop-up and homebound testing. Our overall testing, we see a slight increase in the number of persons showing up at our testing sites as seen in these two charts. The upper right-hand corner chart shows the weekly, daily tests sites, and then the lower right-hand corner shows a daily, over the last couple of weeks, the daily number of tests that we've conducted per day in Palm Beach County. Again, just an ever so slight increase in that trend. And again, we think that that is very important. We're pleased, encouraged by that data. The fact that the risk is higher now, that more opportunities or businesses are open, there's more opportunity for crowding, confined spaces, and close contacting. Testing remains one of the few tools in our toolkit to detect community spread, so we appreciate that being available in the future. In closing, let's all continue to be careful. This last week, our matrix showed 3 red areas, and again, this week we see 3 as well, and we expect to see continued variation over in the near future. The trends that we see include daily positivity rates are increasing slightly. The 14-day daily death numbers are increasing slightly. The daily hospital and ICU census occupancies have remained flat, and the ED visits with CD or with COVID-like illnesses appear to be plateauing. So my words of caution remain. We need to be cautiously watching these numbers, always being mindful of a potential resurgence. That ends my report.
Very good. Thank you very much to both of these professionals for a very detailed update on the conditions in Palm Beach County and statewide. Commissioner Valichet, you recognized for a question.
Thank you, Mr. Mayor. So, Bill, on your chart of COVID-19 positive ICU cases, just looks like the data was compiled incorrectly, because the average is higher than the number of daily cases on every day but one. So I don't see how you get an average that exceeds the number of cases.
Say again.
This is your COVID-19 positive ICU cases, 7-day moving average in a red line.
Correct.
It's above all of the daily values. So I don't see how you get an average that is higher than each daily value other than that one day.
It's a 7-day running. The red line is the 7-day running average, so it takes the previous 7 days included in that.
Oh, okay. So that's not, okay. So that's not just starting there. And,
Right.
Okay.
Right.
All right, I get it. I just want to ask Dr. Alonso a question, which I thought of. You know, we're starting to see the second wave in colder parts of the country. And, you know, people have been speculating forever since it started whether the virus, you know, is affected by cold weather versus warm weather, et cetera. Is it your view that it's the cold weather drives people inside more and into more groups inside, and therefore the virus can spread more quickly? Or is it just the colder nature of the climate?
It's both. The flu comes during the winter months. It starts, we start getting our vaccines in October, and it goes through March. Here we see it lag a little bit behind up north. We start seeing the higher numbers as the people from up north come to stay here for the winter. So we usually get a little bit head notice of how active it is up north and then what we expect down here. But this year we started having cases showing up as early as September, so way before October. So there were several people who hadn't even had the flu shot yet. And they usually are the first ones to get it in October, and they got it in September. So the virus is already circulating for the flu, and this COVID virus is a flu virus. It's a SARS virus, just like H1N1 was back in 2009. So the viruses, the flu viruses themselves tend to be more prominent during the winter months in the northern hemisphere, and the opposite occurs in the southern hemisphere. So a lot of times we see activity happening during the summer months in below the hemisphere, and then that gives us an idea of what it's going to be like in the winter up above the hemisphere. So it's just the nature of the virus. Now, the other thing is that because people are indoor more, obviously that creates then more spreading. What I'm hoping for this year is that we really take care of the flu by having people go to get tested first if they have any of the cough, sore throats, fever, or anything like that, that they go get tested for the flu virus first. If they're positive, that they can get antivirals to help that go quicker. And then if they're negative, then they go get tested for COVID because the symptoms are exactly alike. So getting the flu shot will help you not have to worry about having the flu, and that should help. And also the masks and the washing of hands should help the flu. So I'm hoping to have a very mild flu season as a result of all these precautions that we're taking.
All right, thank you.
All right, very good. I don't see any further questions from members of the board. Again, we thank you for your comments and your efforts combating the pandemic. The public policy of this board has been consistent with regards to public health, and to the extent that we can affect any policy, we will continue to put that first.